This is Dr. Preeti Surana, physiotherapist, consulting with family doctor at Park West, Winnipeg. September 8th is celebrated as World Physiotherapy Day. This year, our interest is in creating awareness about osteoarthritis. Now, osteoarthritis is a condition which affects your bone joints. So, basically, there's inflammation of your joints. A condition that probably subjectively the patient might feel joint pain and joint stiffness. It occurs due to wear and tear of the protective cartilage. If we are talking about knee joint osteoarthritis, the cartilage that protects the joint it gets worn and torn over a period of time. It can be due to age or due to some infection or anything. Most commonly affects the joints of the knees, hips, spine, etc. Now, why this degeneration occurs is usually due to the decrease in the water content in the cartilage. Continuous use of joints throughout the years damages the cartilage. The cartilage becomes flaky and it develops crevices. So new bone outgrowths form around the joint. So sometimes in the ankle when the osteoarthritis will present as spurs. So next thing, what are the risk factors of osteoarthritis? One is age. The second is gender. Females are more prone to getting osteoarthritis. Obesity, joint injuries, joint abnormalities, and also genetic factor. Among these risk factors, obesity and joint injury are modifiable, preventable. So we will talk about it later. Now, how can you prevent osteoarthritis? Preventing osteoarthritis, there are 3-4 things that you can do. First is, how do you prevent joint injuries? Now, if you are a fit person, so then you are supposed to develop good muscle strength. Even that is the one way of preventing joint injuries. If you maintain good fitness level, you're properly trained. If you are into sports and proper training is being taken place, every muscle is strengthened, flexibility is maintained. That way you will prevent injuries. Now, if the injuries happen, you have to follow a post-operative or not operative, post-injury rehabilitation protocol. Generally, a physiotherapist will guide you in strengthening all your muscles and getting you back to your previous fitness levels or getting you back to your previous physical level, so that your muscles are strengthened and a further deterioration of joint cartilage is prevented. Now, after prevention, we will talk about management. Now, though there are many ways of managing, there are over-the-counter drugs to manage pain. But the mainstay of osteoarthritis treatment will still be physiotherapy, that is exercise. Exercise is your medicine. Now, exercise, because it helps in reducing pain, helps in reducing joint stiffness, it increases your muscle strength, and also with regular exercise, you improve balance. Once you improve balance, it reduces your risk of falls. And overall fitness is increased with exercises. Now, exercise can also help in delaying or on the whole preventing a replacement operation. It can prevent further decline of your joint pains, further decline of your joint cartilages. Therefore, exercises under the guidance of a physiotherapist who will check you, who will check your muscle strength and appropriately guide you through an exercise program, and also help you with other assistive devices if required, or kneecaps, knee sleeves, whatever guidance under a physiotherapist. If you undertake exercise programs, you can prevent osteoarthritis. And osteoarthritis, though it is age related, of late we have seen many patients presenting at quite a young age, that is at 40 plus. So if you start taking care at the age of 40 plus, you can probably prevent it worsening when you grow old. Other thing, commonly people ask, running is related to osteoarthritis. The evidence does not show anything like that. People who are running are, in fact, the cartilage recovers well after the run. If it is not done under proper training, without a proper cooling period, then it can cause you arthritic problems. But normally running is not related to osteoarthritis. This video is created to increase awareness regarding osteoarthritis, so that you recognize the pain, the symptoms, which generally will be joint stiffness, decrease in range of motion. Now, if I have to talk about knee joint in particular, you will see that you are having pain in taking up stairs, in getting out of your chair, or frequent knee pains. Early morning, once you get up from the bed, the pain is bad, and by the day, somehow it is manageable. So these are early signs you are able to say that arthritis is developing. This is the point you should consult your physiotherapist. We will guide you as to how to go ahead and develop an exercise. Hi. So now I will be discussing a few management tips, or you can say prevention tips. One of them will be managing weight. So having an optimum weight, or even if you are obese and you are already suffering from osteoarthritis, even a 5 kg reduction in weight will cause a drastic reduction of joint forces on your joints, and it will help you further deterioration. So a little weight loss program has to be undertaken, fitness level has to be maintained. The other things that can also influence management of osteoarthritis is wearing well-fitted footwear that is fitting properly, which is supporting properly. Invest in good footwear, good sports shoes if you are playing sports, and changing the footwear as and when required. The other thing is, if you are aged, if your parents or attenders for whom you want to care, assistive device after the age of 50-55 should be taken with encouragement and not as an embarrassment. So assistive device, they will take away a few of your body weight is distributed on the assistive device like cane. So using a cane will help you prevent deterioration of the joints. The other mistake commonly done is, after you develop knee pains or after you have joint problems, walking uphill and downhill might actually increase your pain. So you must walk on flat tracks. You have walking tracks made these days in the parks and all. So you should walk on flat tracks that are made for walking. And after the age of 50-55, taking staircase for fitness is not really appreciated. If you've already had joint pains, you must avoid staircase. You should in fact maintain your fitness with any other thing, going on a walks or maintaining your aerobic activity in any other way rather than taking staircases and walking. Every time walking, sitting on the floors has to be avoided, so that the joint reaction and further deterioration of joint cartilage is prevented. All these small tips will go a long way in preventing osteoarthritis or managing in the beginning stages. But when it worsens, then you need a physiotherapist and a doctor to help you come out of it. Thank you so much for watching this video.